Hi, my name is Anaya and I'll be teaching you the proper way to use your PPE, your proper personal equipment. I'll be teaching you how to properly put it on and how to properly remove the equipment. So first things first, you want to do is the proper hand hygiene. It's very important to do proper hand hygiene before and after this procedure and any other procedure. Keep in mind, this is a procedure that is usually done for patients that are in isolation for anything that could be very contagious. So you want to make sure you follow these steps correctly because you don't want to come in contact with any of the patient's fluids. So first things first, you want to go ahead, put on your gloves. You would also have a gown, but in this case I don't have a real gown, so I would be using this robe as an example of a gown. So you would want to put a clean new gown through the front. You would want to put it like this, and usually your actual gown has a strings on the top and the bottom. In this case I don't have any, so I'll just kind of like demonstrate. So you would want to cover as much as possible from the back, and you'll tie it. You want to make sure that your entire back is covered, and then you'll grab your strings and then you'll tie them from the back. Once it's tied, you have your gown on. So you want to go ahead and grab your mask. And then you'll put on a face shield if it's necessary, depending on the instructions followed by the agency. So I'll tie this again since it got loose. Okay, so once it's completely on, you want to walk in the room. You'll be probably working with a patient that may be feeling many emotions due to being isolated. So you want to be very nice and polite to your patient, making sure you make them feel comfortable at all times. So you would walk in the room. You want to identify the patient and introduce yourself. So I'll give a brief example. Hi, my name is Anai. I'm the nurse's assistant. Can I get your name and your birthday? And then you will get the person's name and birthday, and you'll confirm it with the wristband. So then once you've come in the room, you're going to want to check for your care plan and see what you are assigned to do. What is your task or procedure that you have to do to the patient. You would answer any of the patient's questions as well, or the patient's company might ask, family or company that's with the patient might ask questions about the person's isolation. You will go ahead and answer those questions for them. Once you are done with the procedure, you wanna kind of observe the patient. The patient might be going through some emotions like feeling lonely, sad, due to being isolated. You want to go ahead and your patient might be bored. You want to offer games, maybe a magazine, something to keep your patient entertained. You want to make sure your patient isn't feeling sad. You'll try to comfort the patient. You'll leave the call light near the patient as well in case they need anything. You want to make sure you treat the patient even if they have a very contagious disease or anything like that. You want to make sure you treat the patient with respect and equally, just by taking precautions, and you'll be fine. So once you're taking care of your patient, you want to go ahead and step out the room. So this is the most important part. You want to make sure you take out your personal equipment correctly, because you do not want to come in contact with any of the micro that might have the pathogens and stuff like that could cause a very serious infection. So you want to go ahead and start off by removing the gloves. So when you remove your gloves, you want to make sure you grasp the bottom of the glove. You want to make sure to never touch because these gloves are contaminated. You don't want to touch the gloves. So you'll pull down the gloves, and with this glove, you want to grab this glove. You never want to touch the contaminated part. So with 2 fingers, you want to slightly go inside of the glove. Notice I'm touching the inside of the glove, not the outside. So then you'll take out your glove, and now notice I'm touching the outside of the glove. The contaminated part is inside. You'll toss this out in the proper garbage or lining bag. Now you want to make sure that you try to not, as much as possible, to not touch the your gown. Well, before you touch the gown, you remove the gown. I'm sorry. You want to go ahead and remove any eyewear, like a face shield or goggles that you were assigned to wear. You would remove those. Now this is where you remove your gown after you have removed face goggles or a shield. You want to go ahead and let the gown drop. You want to go ahead and touch the inside, never the outside. You want to go ahead and let it drop. You see now, I will go ahead and grab with the inside of the gown. And notice I'm keeping it away from my uniform, and I'm touching the inside where it's not contaminated. And you want to go ahead and carefully making sure it's not touching your uniform. You want to roll it up. Once it is rolled up, you want to go ahead and toss it in a proper lining bag. Now you want to go ahead and remove your face mask. Your face mask is last. You want to go ahead and never touch the front. You want to grab it by the back strings, keeping it away from your face. And you'll want to toss that out too. You toss every part of your equipment out. Now you are done. It's super important to do the proper hand hygiene once again, before and after. Very important. And that's it. Thank you.